What's up, PT people? Back at you with another article review. The one we're reviewing today is titled Acute Sensory and Motor Response to 45-Second Heavy Isometric Holds for the Plantar Flexors in Patients with Achilles Tendinopathy. Authors of this article include O'Neill, Radia, Bird, Rathliff, Brandholm, Jorgensen, and Thorborg. I wanted to start with providing you with the level of evidence for this study. It's a level 4, which has been described as evidence from well-designed case control or cohort studies. The potential levels studies can have are 1 through 7, based off the evidence-based nursing care guidelines, which I'm referring to. 1 being evidence from a systematic review or meta-analysis. 2 being evidence obtained from at least one well-designed randomized controlled trial. 3 being evidence obtained from well-designed controlled trials without randomization. 4 I already mentioned, and then it just gets worse from there. 4 is not great, so we'll take that into consideration when reviewing this. I found this article interesting because I've never thought of treating somebody with such a long isometric hold. I'll usually do 5 seconds as kind of the max I'll go, perhaps a little bit longer if I'm providing manual resistance for the isometric. The purpose of this study was to explore the immediate effects of heavy isometric plantar flexor exercise on sensory output and motor output in individuals with Achilles tendinopathy. Methods were 16 subjects with Achilles tendinopathy participated in the study. Sensory testing, assessing pain during a functional task, mechanical pain sensitivity and motor output, and plantar flexor peak torque was completed prior to the intervention. All subjects completed a 45-second heavy isometric plantar flexion contraction and were then retested using the same sensory and motor tests. Motor output was assessed using isokinetic dynamometry at speeds previously identified as of interest in subjects with Achilles tendinopathy. Again, this is just the abstract, so we aren't able to tell exactly how they applied that isometric test, perhaps standing with their heels off the edge of a step in a more neutral position, or standing on even ground, creating some plantar flexion past neutral. We're going to skip the results and go to the conclusion. In this exploratory study, patients with Achilles tendinopathy had a varied sensory and motor output response to heavy isometric contractions. Using the recommended approach of heavy 45-second isometric contractions did not offer a meaningful acute benefit for sensory or motor output for subjects with Achilles tendinopathy. Based on this study, heavy 45-second isometric contractions cannot be recommended for immediate pain relief or improved motor output for patients with Achilles tendinopathy. I wasn't overly surprised by the conclusion of this article. I've never heard of anybody going beyond 10 seconds for an isometric hold. I think the standard is usually 3 to 6 seconds. But if you do something different and you've seen good results or bad results from that, please comment below, like and subscribe, and you'll hear from me tomorrow. Have a good one.